Risking out of care can happen prior to making it into the birth center, and that's usually determined when they're in the office. Or if they have a home birth midwife who's planning to deliver their patient in the birth center, they may contact me and notify me that this patient's no longer eligible for the birth center. That again goes back to either maternal or fetal reasons. So for maternal reasons, the most common is high blood pressure. If you're dealing with gestational diabetes, meaning diabetes that is only caused from the pregnancy, not diabetes prior to the pregnancy, if not well controlled with diet alone and requires medications such as insulin or pills, that would consider a risk out. If mom was having any other medical condition that would be considered ineligible or losing the eligibility criteria to be in the birth center, those are also part of that. If we're talking about the fetal reasons for the baby, then the concern we have is baby's growth. Is the baby's growth falling behind? Are they on the smaller side or growing too big and look like a linebacker for the New York Giants? If they're getting bigger than normal size, we don't discriminate about babies being 8 pounds or even 9 pounds, but if they're edging towards close to 10 pounds, that might be a little too much for the baby. If the baby has any medical conditions that may require some follow-up with a pediatrician or the NICU team in a hospital setting, we would recommend that mom risk out for the birth center because she would need to have that baby evaluated sooner than later in a hospital setting. So there's multiple reasons.